Dr. Jean Loftus, author of The Smart Woman's Guide to Plastic Surgery, is here this morning to explain everything you need to know about breast implants. Good morning, doctor.
Good morning.
This applies to the conversation we had about liposuction yesterday as well. Does it really make these women happy?
Unbelievably so. These women are so happy after surgery. I have had women at their own family picnics, maybe have a little too much to drink, and rip open their chest to show everybody. They are so happy. Most women
This is what I got instead of Christmas presents for all of you this year.
Most women who have breast implants start with a very modest amount of breast tissue and simply want to fill out their body and look natural and fit their clothing, and it just creates such a transformation in them.
It seems like there are some women who just want to tweak their physique, either there or by slimming up their hips or whatever, and others who probably have deep-seated self-esteem issues, and this would be just kind of a Band-Aid solution to it. Whose responsibility is it to decide if the patient is in there for the right reasons or not?
The plastic surgeons, and thanks for bringing that up, because that's such an important issue. If we as plastic surgeons detect that someone wants cosmetic surgery for a reason other than simply to look and feel better about themselves, then that's a red flag to us that they shouldn't be having it.
But are doctors scrupulous enough to turn down the money?
The good ones are.
Yeah, that's the trick, to find the good ones out there. All right, let's talk about this breast implant scare of the early 90s, because silicone implants are now generally not available in this country as a result of that, but you think they're safe.
Well, not only do I think they're safe, but plastic surgeons in general think they're safe. What we found is that silicone implants do not cause the diseases that they were alleged to have caused. They were alleged to have caused lupus-like diseases in some women, and what we have found is that women with silicone implants are no more likely to develop these diseases than women who don't have implants. And the silicone implants are currently under study. We hope that they'll be back on the market within the next 5 years or so.
The implants that have been available for the past several years and are available now are saline, which is salt water, and you think that's inferior to the silicone gel?
I don't think inferior, but I think the absolute best results with a silicone implant are a little better than the best results with a saline implant.
More natural?
In many cases, yes.
All right. There are also different ways to place the implant, either above the muscle that's on the breastbone or below. And we've got a picture here, and tell us about the pros and cons of it.
Well, on the left, what you're looking at is you're looking at the implant in yellow, and it's sitting on top of the muscle. And on the right, you see the implant with a muscle over it. And the benefits of putting the implant under the muscle are that it less interferes with mammography. And of course, most women are aware that their risk of getting breast cancer is 1 in 9. And so less interference with mammography means better breast cancer detection.
So it's harder to spot a tumor if you've got this foreign object in there interfering.
Correct. Now, even so, even if you put the implant in over the muscle, you can still see 75% of the breast tissue on a mammogram.
All right. What about scarring? Because some procedures lead to more scarring than others.
Right. Well, let's talk about scarring on the outside of the breast, then on the inside of the breast. There are 3 main choices for placement of the incision. One is under the breast, one's around the nipple, and one's under the arm. All of those are generally reasonable choices, and I'd go with whatever your plastic surgeon recommends. One choice I would not recommend, though, is through the belly button. Some surgeons are offering this operation through the belly button. I would not recommend it because the implant manufacturers will not warranty their implants if it's placed through the belly button.
That seems like a long way to travel.
It sure does. Yeah, and as a surgeon, I can tell you, if you get into trouble under the breast when you're going through the belly button, you don't have a lot of opportunity to get yourself out.
I was also fascinated to learn that the sort of casing is put in there and then the gel is injected after it's in place, which is why you don't have to make a huge incision.
Well, in fact, it's not gel, it's saline. And,
correct, now that the gel's not available.
The fact that the implant is empty allows us to make a very small incision, place the implant, fill the implant with saline until it's to the desired volume, then we simply remove the tube and voila.
And you have to stitch up the casing, or somehow it has to be sealed?
We stitch the skin. The implant itself, where the tube goes into the implant, is self-sealing. So the minute we pull the tube out, it automatically seals.
And the cost of procedures like these?
Anywhere from $5,000 to $7,000 across the country. That includes a surgeon fee, implant fee, anesthesia, and hospital or office fee. But expect to pay 1.5 times that in New York.
As always. And what kind of pain and recovery time?
Depends on if you place the implant under the muscle or over the muscle. Under the muscle is definitely more uncomfortable. It's still an outpatient procedure. Expect at least a week away from work.
And real quick, some women opt for a lift as opposed to implants. Quickly, what does that do?
A lift will simply raise your nipple up to the position it once was, but an implant will increase the volume of the breast. 2 very separate things, but can be done together.
I did want to make sure we brought that up. Anyway, Dr. Loftus, thanks very much.
Thank you.
Appreciate it, and we'll be right back after this. Stay tuned.